Hello, and welcome to another session of Close Calls with California Poison Control System. I'm Dr. Race Vora with the California Poison Control System Fresno Madera Division, joined by my co-host, Dr. Cyrus Rangan, also with California Poison Control. And our featured speaker today is Dr. Solana Archuleta with UC San Diego, and also a medical toxicology fellow with California Poison Control System. Welcome, Dr. Archuleta and Dr. Rangan. Let's just jump right into this topic. The larger topic is inhalants, and the specific one is nitrous oxide. Cyrus, we'll start with you. Tell us what are inhalants and why this topic of nitrous oxide is such a hazard that we keep hearing about on California Poison Control hotlines.
Sure. Well, inhalants have been around for a very long time, and people will use the gases that are inside these inhalants essentially as a recreational drug. And these can lead to some very serious and very harmful health effects as a result of these exposures. And there's many, many different sources of these inhalants out there.
Great. Dr. Archuleta, can you tell us more about nitrous oxide? Where do people find it? What exactly is it? And why are people using and abusing it in your experience?
Sure, yeah. So nitrous oxide is a gas composed of nitrogen and oxygen. And a lot of people will know it as laughing gas used in the medical industry. However, it's also used recreationally, and people will get often these whipped cream canisters or chargers that are really small. They're about the length of a finger, and they'll use the gas from that and often put it into a balloon and then inhale that. And the reason that people do it is because it gives them a short high, some euphoric effects, but there's also some dangers from that as well.
Let's talk about those. What are some complications and problems that people can have if they're abusing nitrous oxide?
Yeah, so we see two different types of problems. We see the ones that are what we would say acute or that show up right away. And then there's problems that occur from using it chronically or over the long term. And so acutely, people can get, again, some euphoric feeling, but they can also become confused, potentially sleepy. They can have more dangerous effects of their heart beating abnormally or even seizures. And then over the long term, using it can actually lead to damage of the nervous system. And we see a lot of damage of the nerves, especially in the legs, and people can get numbness, painful tingling, and that can lead to things like difficulty walking or balancing.
Wow, sounds very serious. What sort of experience would someone have? You know, suppose that they do get affected by this drug and now they're in the emergency department. As a toxicologist, what kinds of things can you say you would have to recommend to someone who's intoxicated, either acutely or chronically, from this nitrous oxide?
Yeah, so acutely, we could support them through whatever that intoxication might look like for them specifically. We would have them hooked up to monitors, potentially be giving them oxygen, and of course, telling them to probably not use this recreationally again. And over the long term, if people are coming in with more of those neurologic symptoms, then there's specific blood tests that we can do. Sometimes people might need an MRI to diagnose that specifically. And then we can think about treatment. And that's actually usually just with vitamin B12, because that's how it affects the nervous system. And that treatment, unfortunately, needs to be done for a long time, sometimes weeks or months.
Yeah, that could be a real challenge. Well, thank you, Dr. Rangan and Dr. Archuleta. I think we'll wrap up this session talking about nitrous oxide dangers with a few key takeaways. So one thing that we want everyone to remember is that recreational use is very dangerous because it can have acute and also long-term damage. And that long-term damage can be permanent. So the effects that we talked about today to your nerves and to your brain might take a long time or last forever. And so that's a very serious side effect that we see. And for parents and guardians, just know that there's a lot of different names for this hazard. Sometimes it's called Whippets. Sometimes it's called galaxy gas or laughing gas. There's probably many other names. This is an inhaled product that can cause a lot of problems. We know young people are unfortunately exposed and getting into it. So just be careful and remember to talk to your kids about safety around illicit drugs, including nitrous oxide, whenever it's used in that context. We're always available 24/7 at our poison control hotline. You can call 1-800-222-1222 for any questions you have about nitrous oxide, inhalants, or any other poisoning prevention hazards or topics that you want to discuss. We're always happy to answer your questions. I want to say thank you so much to Dr. Solana Archuleta and Dr. Cyrus Rangan. I appreciate you sharing your information and advice today. And we'll see you next time on Close Calls with California Poison Control System.